One quiet paperwork mistake can cost you nearly $6,000 over the next 10 years, and it never goes away. Today, I want you to meet two people, Frank and Diane. Same birthday, same job, same first day of Medicare eligibility. But they made opposite choices in their first year on Medicare. One choice created a permanent monthly penalty, the other didn't cost a dime extra. By the end of this video, you'll know exactly which Medicare deadlines are truly high stakes, the kind that follow you for life, and which ones just cause a short delay. Frank turned 65 while still working, covered by his job's health plan, so he had a special enrollment period to delay Medicare without penalty. When Frank retired 2 years later, he kept COBRA continuation coverage instead of signing up for Medicare right away. He assumed COBRA counted the same as active employer coverage. It doesn't. Only active employment coverage protects you from Part B's late penalty. Frank's 8-month special enrollment period to sign up penalty-free started the day his active job ended, not when his COBRA ran out. He missed it without realizing. Diane turned 65 the same year as Frank. She used her initial enrollment period, the 7-month window that starts 3 months before your birthday month, includes it, and runs 3 months after. Diane signed up for Part A and Part B right in that window, before her employer coverage even ended. She paid the standard premium from day one with no penalty and no gap in coverage. It felt almost too simple, but that's the point. The initial enrollment period is the one deadline every future Medicare decision gets measured against. By the time Frank realized his mistake, his special enrollment period was long gone. His only option left was the general enrollment period, which runs January 1st through March 31st every year. Since 2023, coverage now starts the first day of the month after you enroll, better than the old rule, which could delay coverage until July. But the general enrollment period doesn't erase one thing: a late enrollment penalty, calculated from every full year he went without Part B. Here's the math behind Frank's bill. Medicare adds 10% to the Part B premium for every full 12-month period you were eligible but didn't enroll. Frank waited 24 months. That's a permanent 20% penalty. In 2026, the standard Part B premium is $202's $90 a month. 20% of that is about $40.58 extra every single month for as long as Frank has Part B, most likely the rest of his life. That's roughly $487 a year Diane simply doesn't pay. Diane had one more decision window most people don't know about: her Medigap Open Enrollment Period. It's a one-time 6-month window that starts the month you're 65 or older and enrolled in Part B. During those 6 months, insurers cannot deny you a Medigap policy or charge you more for pre-existing conditions. Diane used hers immediately, locking in a supplement plan at a fair rate for as long as she keeps it, regardless of any future health changes. Frank wanted a Medigap policy too, 3 years after his Medicare started, but his 6-month Medigap window had already closed, and he didn't qualify for a guaranteed issue right. Outside that window, insurance companies can legally refuse to sell him a policy, charge him a higher premium, or make him wait 6 months for coverage of any pre-existing condition. Frank ended up paying more for less protection, simply because of timing, not health. Frank had one more gap. He went without Medicare drug coverage for 24 months before finally signing up for Part D. That penalty is 1% of the national base beneficiary premium, $38.99 in 2026, for every month of that gap. 24 months adds up to a 24% surcharge, about $936 extra a month. And this penalty isn't frozen. It recalculates every year as the national base premium changes, added to Frank's bill for as long as he has Medicare drug coverage. Added up over 10 years, using 2026 rates held steady for simple math, Frank's Part B penalty alone runs close to $4,170. His Part D penalty adds roughly another $1,020. That's nearly $6,000 more than Diane paid for the exact same coverage for 2 timing mistakes instead of 0. Diane's only extra step was learning her deadlines. Frank's mistake wasn't about money he didn't have, it was about dates he didn't know. One more layer applies to both Frank and Diane, no matter how carefully they enrolled. IRMAA, the Income-Related Monthly Adjustment. In 2026, if your individual income is above $109,000 or a married couple's joint income is above $218,000, you pay a surcharge on top of your Part B and Part D premiums. IRMAA looks backward. Your 2026 premium is based on your 2024 tax return. It's not a penalty for missing a deadline. It's simply the cost of higher income, and it applies to everyone at that level, on time or not. So which deadlines are truly permanent and which are just a delay? Missing your initial enrollment period without a special enrollment period risks lifelong penalties. But 2 other windows are simply about choice, not penalty. The fall annual enrollment period, October 15th to December 7th, when you can switch Part D or Medicare Advantage plans for the coming year, and the Medicare Advantage Open Enrollment Period, January 1st through March 31, for a one-time plan switch if you're already in Medicare Advantage. Use those every year. They cost nothing to miss, but they can still save you money. Frank's story isn't rare. It happens to people who did everything else right but trusted one wrong assumption about COBRA or enrollment timing. The good news, every one of these dates is knowable ahead of time. Download the free retirement deadline checklist, link in description, and mark these dates before they sneak up on you. This video is for education only and is not financial, tax, or medical advice. Some visuals and narration are produced with AI assistance. If this helped you, subscribe. I'll see you in the next one.